Alex Plum, the Executive Director of the Corner Health Center, who has provided both PowerPoint slides as also a written testimony. Thank you for being here.
Thank you, Senator Anthony, and members of the Senate Appropriations Committee for the opportunity to speak to you today. My name is Alex Plum. I'm the CEO of the Corner Health Center, Michigan's first and largest freestanding integrated health center, specifically serving adolescents and their children. We're headquartered in Ypsilanti with sites throughout Washtenaw County and St. Joseph County. The Corner provides medical and behavioral health care for roughly 10,000 young people aged 12 to 25 and their kids from across Michigan. In doing so, we give away over $1 million annually in uncompensated care because the needs of our young patients exceed what they and their parents can pay. We rely on funding from the school aid budget, particularly the Child Adolescent Health Center program, which helps us to cover this balance and extend health care to vulnerable children in partnership with the state's robust Medicaid health plans. The federal budget reconciliation law passed in July puts all of this at risk. Community health centers like mine and around the entire state face devastating economic impacts because of the $1 trillion in spending cuts from federal programs, including Medicaid and the ACA marketplace. This is what will happen to the Corner. First, the Corner will lose revenue. Approximately 75% of our patients rely on Medicaid, which counts for $675,000 of our medical billing receivables. The Congressional Budget Office estimates that 7.8 million Americans will lose Medicaid, an 11% reduction in total enrollment. The Urban Institute estimates that 3 in 10 young people between the ages of 18 and 24 will lose Medicaid. If 11% of my patients lose Medicaid, the Corner will lose $75,000 in revenue. 30% would be closer to $250,000. In turn, the Corner will be forced to reduce how much we spend on staffing and on goods and services from vendors, most of whom are local Washtenaw County businesses. They'll also need to cut their spending on labor, goods, and services. These businesses, together with the Corner, will manage our cuts by laying off staff, by cutting benefits, and by reducing compensation. These are the secondary impacts to the cuts to Medicaid. But there's more, and it happens further downstream. The staff who are laid off will lose household income, and their spending will be adjusted accordingly. They'll make fewer purchases, consume fewer services, and struggle to meet the expenses of daily living like food and rent. The Commonwealth Fund refers to these third-tier impacts as induced losses, and that's their pictogram in the slide. They note that because of these lost personal and business incomes, state and local revenues from income sales and other taxes like real estate taxes will also be reduced. A loss of $75,000 may seem small, but it's 2% of our budget. To put it into perspective, if 2 of the largest health systems in Michigan, Henry Ford Health in Detroit and Corewell in Grand Rapids, each lost 2% of their revenue, an incredibly conservative estimate, the impacts would be tremendous. According to publicly reported numbers from 2023, a loss of 2% to Henry Ford Health's revenue would be a loss of $90 million. For Corewell, it would be over $207 million. Think about the direct hit to our economy if we lose $300 million of revenue that would otherwise be spent on Michigan jobs, Michigan goods, and Michigan services. As of 2023, Michigan had 39 critical access hospitals, 10 of which were in the Upper Peninsula, along with 40 federally qualified and community health centers. These hospitals and community health centers disproportionately rely on Medicaid reimbursement. If their patients lose Medicaid eligibility and do not have commercial insurance through an employer, they'll have to turn to the ACA marketplace. But the marketplace is also being decimated. The bill did not extend marketplace enhanced premium tax credits, meaning on average, an average marketplace enrollee will pay $700 more in taxes and lead an additional 4.2 million people to becoming uninsured. These insurance coverage losses generate $7.6 billion in medical debt. The Journal of the American Medical Association Health Forum estimates that by 2034, across the U.S., 302,000 jobs will be lost, $135.3 billion lost in reduced economic output, and state and local authorities will lose out on over $11 billion in tax revenue. And this is just because of the tax credits. In a comprehensive analysis of the economic impacts of the cuts, the Commonwealth Fund estimates that 1.22 million jobs will be lost by 2029, and in Michigan, it will lead to an increase in unemployment of almost 1%. The math is clear. If people do not have health insurance, they will stay sick longer, miss more work, save less, spend less, and require more public assistance. As my testimony has demonstrated, the economic impacts, particularly to children and adolescents, are profound. But in closing, I'd also like to point out the moral injury that this bill causes and what you can do about it. Low-income earners stand to lose the most. The Congressional Budget Office estimates that the lowest 10% of earners will lose, on average, $1,600 worth of health-related resources per household, while at the same time, the top 10% of earners will take those resources, helping each of their households gain an average of $12,000. This is a shocking and radical redistribution of resources from the poor, who already have so little, to the ultra-wealthy, and it is a sign of a very sick society. The Senate Appropriations Committee can help heal this moral injury by ensuring that the FY26 school aid budget protects Medicaid-matched programs like the Child Adolescent Health Center program. Over 300 child adolescent health centers exist in Michigan, providing comprehensive medical and behavioral health care to over 200,000 students in 59 counties around our state. How we choose to live alongside our most marginalized and vulnerable neighbors says everything about our state's true health. While the federal budget reconciliation bill aims to make us a sicker, poorer people, in Michigan it does not have to be this way. Senator Anthony, I'm grateful for the invitation to come and share the experiences of the Corner Health Center and school and community health centers like mine from around the state. Together with you and members of the committee, we look forward to working to redeem what is broken and restore health to all who come through our doors. Thank you very much, and I'm happy to take your questions.
What are some of the areas in our state that might be hard to see things?
So I pointed out there are 300 child adolescent health centers funded by the legislature in 59 counties. So one of the goals that the Child Adolescent Health Center program has with the School Community Health Alliance of Michigan is to increase that this year. In fact, I believe that the Senate Appropriations Committee and the Senate passed a bill, your version of the School Aid Act included increased funding so that we could get additional child adolescent health centers in every county. The counties that are going to be disproportionately hit are our most rural ones and the ones serving urban centers. And these are the areas where we have the highest rates of utilization in those community health centers by children and their families. So what we tend to see in those centers are young people who are coming, they're either already on Medicaid or are coming for uncompensated confidential care. Confidential services in those centers basically include things like STI testing, pregnancy care, things that they need to be able to take care of immediately, and for whatever reason they're unable to access through their families. What we found disproportionately in the Child Adolescent Health Center program is that those families are unable to take care of those needs because they don't have sufficient coverage.